Hello, everyone. We welcome you to this special edition of Health and Family. In light of the upcoming Olympic Games in Brazil, it was decided that we would endeavor to learn as much as we could regarding the Zika virus. We hope to answer questions such as how long it's been around, what are the chances of contracting this disease, and many more. Hoping to shed light on this serious subject is Chief Medical Officer Cheryl Peak-Ball and Nurse Epidemiologist Jennifer Wilson. Ladies, welcome to Health and Family.
Thank you.
Thank you.
So, Dr. Ball, I'm going to start with you. What exactly is the Zika virus?
Well, Zika virus is one of a family of many viruses similar to it that can infect animals and human beings. It's in the genus Flavivirus, for those who care about that kind of thing, and it is significant because it does infect human beings as well. It's carried by mosquitoes. That's the most important point we want to make today, is that the mosquito is the vector or the means for that virus getting into the human body.
And so where did this virus originate from?
Well, evidence shows that the first identification was in rhesus monkeys in the forests of Uganda, Zika forest, and that's how it gets its name. So that was back in 1947. Interestingly, there were not any large outbreaks of it until later, much later, in fact 2007. So from 1947 it can be tracked along a strip of the countries along the equator from Africa to Polynesia, where it slowly made its way into the Polynesian islands, and there was this very pronounced outbreak in 2007. There had been before then just sporadic incidents across parts of Africa and Asia.
Okay. And so what countries currently have the Zika virus today?
The easy way of thinking about it is that it is predominantly the outbreak at the moment in South America, Central America, and the Caribbean. However, the number of countries is quite large, and the countries are changing every week. You can find new countries, so rather than focus on the specific countries, we refer people to the websites that keep that information up to date, particularly the CDC.gov website or PAHO.org, PAHO.org, the Pan American Health Organization's website. And you can actually go down as close as the country and the locale that you're going to be visiting to get up-to-date information about the transmission in the region.
And you strongly recommend that, I would assume.
Yes, absolutely.
Yeah. So here in Bermuda, have we had any cases of Zika?
I should definitely make that clear that at this time there have been no identified cases, and we consider that Zika has not arrived in Bermuda, but there is very active surveillance around that to make sure that we do identify it when and if it happens.
Okay. So Ms. Wilson, coming to you, what are the symptoms of the Zika virus?
One thing about Zika virus is that most people don't have symptoms. About 4 out of 5 people won't have symptoms, and that's what the challenge is. If they do have symptoms, usually they would be mild, and they would likely be fever, rash. Some people complain of joint pain or muscle pain, and really red eyes called conjunctivitis. So those are the most common symptoms, but most are asymptomatic.
Okay, and so how is the Zika virus actually diagnosed?
It is diagnosed by a blood test. Well, we have accessible to us a blood test. You might read, for example, on CDC that it can be tested in urine and other specimens, but in Bermuda it's a blood test. It's not done locally. At the Department of Health, we send the specimen to CARPHA, which is the Caribbean Public Health Agency, and King Edward would send a specimen to a reference lab called Quest. So it's actually a blood test, but only for persons who are ill. So if you've had symptoms or you're recovering from symptoms, then you can get the test. If you don't have symptoms, like most people, the test is not necessarily reliable.
Okay. And so can the Zika virus be treated at this time?
There's no specific treatment for Zika. Usually you would treat the symptoms. So if you have joint pain or muscle pain, you would treat that symptom. But what I do suggest is that people seek help from their healthcare provider and get, some recommendations from them.
Okay. So staying with you, Mrs. Wilson, how do people actually catch the Zika virus? Dr. Peekball mentioned through the mosquito.
Yes.
Specifically, what's going on? The mosquito bites you, and then
Right. The main way people catch the virus is through mosquito bites. Okay. So you'd need to have an infected mosquito, a specific type of mosquito called an Aedes type mosquito. Mm-hmm. The most proficient one is the Aedes aegypti, which we don't have in Bermuda at the moment. Mm-hmm. But the Aedes albopictus can also transmit, we think, not as proficiently. So that infected mosquito, meaning it bit somebody who already has the disease, would have to bite another person. So that's the main way that you would catch it. But what we've also found is that it can be passed to the unborn baby with a pregnant woman, mm-hmm. either during the pregnancy or shortly after birth. And it can be transmitted sexually from a male to his sexual partner. But remember, the male would have to be infected. And we're not sure whether he has to be symptomatic or not.
Okay.
Right.
So is there a special type of person that is usually, I don't want to use the word eligible, but is more at risk of contracting this disease?
Well, anyone who's never had it can get it. We don't actually have it in Bermuda at the moment, so our thought is that your risk would be associated with travel. So if you travel to a country that has ongoing transmission of Zika, then that will put you at risk. Okay. Or if your sexual partner has traveled to a country where there's ongoing transmission, then you can be at risk as a sexual partner of a male.
So you really need to know who
Yes.
your sexual
Yes,
partner
yes,
is.
Yes.
Wow. So do we have the mosquito capability of spreading the Zika here in Bermuda, little island? Yes.
Yeah. Well, we don't have the Aegypti, which is the most proficient, but we do have albopictus. So we're not counting out that we cannot have transmission. We just think that perhaps it's not as proficient, it's not as capable, mm-hmm. but it has been shown to be able to be capable of doing that.
Okay. Yeah. Back to you, Dr. Ball. So the Olympic Games are around the corner. What are the risks to the travelers, to all the athletes, so many people going there?
Yes. Well, the Olympic Games, as you know, are in Rio, yes. And Brazil is where this current epidemic began, and it is very important that travelers to South America that have transmission, countries that have transmission, including Brazil, are very aware of their travel health needs, and that would start first with general travel advice to have input from a travel advisor about basic immunizations, mm-hmm. measles, mumps, rubella, tetanus, those kinds of things. But as it relates to Zika, it's additionally important to know how to protect oneself. And this is a daytime biting mosquito, so it is important particularly to use insect repellent, to be vigilant about that and to reapply it as necessary. Also to wear long clothing and to just be protective against mosquito bites in the first instance. So that's what's important before you go. Getting that advice and reinforcement in a travel setting is ideal. After you come back, what is very important is that you are protecting yourself and others from the risk if you had contracted Zika. So, and I didn't say this about before you go, it's also important to recognize that the most vulnerable people when it comes to Zika would be the unborn child. So that at this time, the World Health Organization has actually taken a very bold step to advise pregnant women not to go to Brazil at this time, to the Olympics. But certainly for women who are contemplating pregnancy, it will be very important to prevent pregnancy during that visit and for at least 8 weeks following the visit, so that there's no chance of an asymptomatic infection. As Jennifer said, the infection in adults is typically very mild, and you may not know you have it, so you have to prevent pregnancy for the period of time that you could possibly be incubating the virus or infected with it but not know it. So women who are of childbearing age should be very careful not to get pregnant for at least 8 weeks after being in that setting. Additionally, men have a very heavy burden when they have traveled to an area where there is active transmission of the virus, and that is because the virus is known to persist in sperm in semen for up to 6 months. And so if you have actually had the infection, you're very likely, much more likely to have that happen. And so if an individual, a male, has traveled to a place where there's active transmission and their partner is anticipating pregnancy, they must absolutely be vigilant about protecting from pregnancy for minimally the 8 weeks if they are well, but 6 months if they're intending a pregnancy. They should be using protection condoms, using them properly and consistently to prevent pregnancy, or abstaining for that length of time if they have been known to contract the disease or were symptomatic with the disease. So preventing pregnancy and preventing the transmission through pregnancy is what is paramount when it comes to Zika. The actual disease burden for an individual is not so exceptional. It's what happens if a child is conceived and a mother is infected with the virus.
All righty. We're going to take a commercial break. Actually, we're going to watch a little video produced by WHO, the World Health Organization, on Zika. We'll be right back. And we welcome you back to Health and Family. If you're just joining us, we are talking about the Zika virus with Dr. Peek Ball and Mrs. Jennifer Wilson. So you were talking about the athletes in Rio and as far as protecting themselves and so forth.
And travelers to that area
yes,
in general. The
lot,
athletes are at no greater risk than anyone else. And I believe I was saying how important it is to, before you go, get travel advice. While you're there, protect from mosquitoes. And I want to stress that once you come back, particularly preventing pregnancy in women and preventing impregnation for men. So using condoms and protection after a visit to an area where there's active transmission, and preventing mosquito bites after you return as well, because you can be incubating the virus once you return and be bitten by mosquitoes. So it's very important to protect yourself from mosquitoes that are in Bermuda. And I guess we'll talk a little bit about how important it is for Bermudians to get rid of the mosquito, because without the mosquito, you're not going to have Zika. And so that if it is imported, for individuals who travel to an area where they could have been bitten by a mosquito and have the virus, whether they experience symptoms or not, they must prevent themselves from being bitten by mosquitoes even after they return to Bermuda. Okay. Yes.
And so you had mentioned the insect repellent and,
yes,
and wearing long sleeves if necessary to prevent the mosquito bites.
Yes, and preventing mosquitoes around your home and in areas that you are living, so that's equally important.
No standing water or anything of that
Absolutely.
nature. Is there currently a vaccine for the Zika virus?
Unfortunately, there isn't, but as you can imagine, there's intense investigation in that area. But the latest report about when such a vaccine would be available indicates it's going to take about 36 months. So we're 3 years away from a vaccine. The real thrust of the prevention is mosquito control primarily. So that is where the effort should go, and people should feel very focused on that goal.
Okay. So Dr. Ball, continuing on with you, what makes the Zika virus so paramount compared to all the other illnesses that are currently going on now?
That's a good question, especially because in a healthy adult, the actual infection can be either without symptoms, as Ms. Wilson said, or very mild. What makes Zika special is what happens to an unborn child in the setting of Zika and the possibility of transmission across the placenta from a mother who has Zika to a baby who has Zika. And the issue there is that it can cause very severe, profound neurologic defects in the developing fetus. And so those defects have great implications public health-wise in terms of the challenge of taking care of children affected by Zika in utero. So the impact in that way is quite great, and that's what makes Zika so important to prevent. Also, there are cases of a neurologic condition called Guillain-Barré syndrome, which is something that happens in others, not just the newborn baby, but in adults and children who are affected with Zika. Now, this is not something that happens typically. This is the more exceptional complication of Zika viral infection, but it can be a serious neurologic defect that results as a result of the virus. And so Guillain-Barré incidence has been documented as increasing in regions where there is active transmission, and the correlation has been well established. So we certainly are concerned about preventing Zika because of the impact of the neurologic implications to people, a subset of people who get the virus, as well as the congenital defect, the microcephaly, the small head and the small brain in the babies that are affected. The picture. Yes, very dramatic situation, and for that reason, Zika virus and the prevention of it is considered extremely important at this time.
Okay. So it is the summertime, the height of the summer travel. Many of us are actually getting ready to go on vacations. How can we protect ourselves here in Bermuda and to where we travel to?
Well, it's good to have that conversation because wherever you're traveling, even outside the setting of Zika, before Zika, there was a need for travel health knowledge. And so I think the best thing people can do is to get informed about their destination and make sure that they know what the health risks are there generally. I mentioned earlier the need to make sure that your routine immunizations are up to date, but particularly when you're thinking about mosquito-borne illnesses, be prepared to protect yourself with insect repellent, especially in a region where there is active transmission of this virus. But also, we mustn't forget there are other viruses that are carried by mosquitoes, like chikungunya and dengue and yellow fever, that are very, very serious and must be prevented. So we really have to start seeing the mosquito as not part of the family, something that we suffer, but really just a bane that we have to prevent bites from mosquito as well as prevent mosquito breeding. And with regard to travel also, I think it's important to think about the protection before, during, and after the travel, so that in the case of Zika, the importance of preventing pregnancy around the travel time and preventing transmission if you've been sick as a male, preventing transmission to your female partner is extremely important.
All right, so protection, key.
Yes.
Very, very key. So Mrs. Wilson, so if a person has been exposed to the Zika virus, what steps should be taken to maintain their health and to obviously not to spread the infection to others?
Much of the answer to that question was mentioned by Dr. Peekball already. But if you do experience symptoms of Zika and you've had a history of travel to a country affected by Zika, then firstly you should seek your healthcare provider's advice. So seeking your healthcare provider's advice, he may want to get blood work drawn, not just for Zika, but also for dengue and chikungunya, the other mosquito-borne viruses.
Is malaria still?
Malaria is still around, not in, endemic in some countries, meaning common in some countries. We do not have the mosquito capable of transmitting malaria in Bermuda. It's a different mosquito. But we do occasionally have imported cases of malaria. Yes. So once persons seek medical advice, then the next step is to treat the symptoms, which may mean getting plenty of rest, drinking fluids if you're dehydrated. It may mean taking acetaminophen if you're achy, but all under the direction of your healthcare provider. Your healthcare provider actually reports that information to our department, which is the Epidemiology and Surveillance Unit. And then that's where my role comes into play, where I would put control measures into place, meaning advising people, as we've advised already, to avoid mosquito bites and prevent sexual transmission and to prevent pregnancy. And also sending vector control to their area. So vector control will be sent, and they would do about a 2-mile radius outside of the person's residence, looking at mosquitoes, so providing surveillance, and also perhaps destroying breeding sites.
Will this person be in quarantine, is what it says?
Not necessarily in quarantine, but they will be advised to avoid mosquito bites during that infectious period, because they're not going to be infectious during, it's maybe a week of being infectious, avoiding mosquito bites during that time, and then also controlling mosquitoes in that area.
Even with protection, they should avoid.
Yes.
Okay.
Yeah.
So is there any particular group of individuals that is more prone to the Zika virus than any other?
Well, as Dr. Peekball mentioned, pregnant women, the unborn fetus, the males, because of their potential for sexual transmission. I would say that those are the main groups that are at increased risk for complications.
Okay. So is it the same impact on both males and females, or is it more on females because she has the capability of getting pregnant?
Yes, I would say. I mean, the illness can still be mild in both. Or they can have symptoms, but the impact is the potential for the male to transmit sexually and the female, as you said, because of the fetus and potential for pregnancy and passing on to the fetus.
So if a female does find herself pregnant and she gets the Zika virus, what should be her steps to protect herself and her unborn child?
She should firstly, if she has traveled to a country where there's Zika, she should firstly inform her healthcare provider that she has traveled. What would be great is if she's planning travel, if she seeks that advice first and foremost from her healthcare provider on what she should do. Although it has been advised that pregnant women don't travel to Brazil for the Olympics, there's also a recommendation that pregnant women consider postponing travel to the other countries where there's ongoing transmission. Okay. It's a consideration. So if she does travel there, she should protect herself just as anyone else would, using mosquito repellent, an EPA-registered mosquito repellent that's safe for pregnancy, covering, long sleeves, sleeping in screened places, because sometimes if you're not staying in a hotel of a certain level, you may not have screens on the windows. So getting a hotel that's screened, air conditioned, those types of things.
Makes a big difference, yes. Dr. Ball, so the World Health Organizations, what has really been their response to the Zika virus thus far?
Well, it's been a very organized and I think very helpful response. Starting back at the end of last year when it became obvious that something was going on with mosquitoes and Zika and babies in Brazil, they did what they always do, which through their international surveillance notify the rest of the world. The international health regulations is a legal vehicle for connecting countries in terms of information. So the World Health Organization has been instrumental in first convening meetings that deal with the issue, identify what the problem is, and then communicate to countries. And so in February of this year, 2016, that would have been the second emergency meeting was convened by the World Health Organization. And in that setting, what is done is decision-making, giving the evidence of what's happening on the ground, so that that the decisions out of that meeting were that the situation with Zika was so severe that it should be turned into what we called a public health emergency of international concern. And that specific designation gives countries a host of response activities that they should be doing to protect and to control the entry of the virus into their areas. And so the World Health Organization's coordinating the information sharing, as well as the clinical advice, the laboratory protocols, the vector control, the integrated vector control measures, all that a country needs to do to protect itself. The World Health Organization is quite instrumental in sharing that information and coordinating it and assuring that people have the resources, and for some countries the funding, to do what they need to do to address the problem. So the WHO is highly regarded and relied upon by all countries for those reasons.
Okay, so this is going to be our final question, and we can ask it to both of you. I'll start with you, Mrs. Wilson. What can every citizen do to help prevent Zika coming to Bermuda?
As we spoke, every citizen can keep up to date with what countries are affected by Zika to seek travel advice before they travel to these Zika-affected countries, take mosquito precautions when they travel to avoid mosquito bites. When they do return, really consider that preventing the spread of the virus locally by continuing to avoid mosquito bites, by preventing sexual transmission, by seeking medical advice if they are ill, by also controlling the mosquitoes in their area, emptying standing water in their yards. If everybody did that, it would be quite an effect on the whole island. If they do have a mosquito problem, then call vector control. They are in your area daily, but they do, if you do have a mosquito problem, they would address it. Would you say, what else would you say?
You've covered everything. I mean, very thoroughly. I think the real message is that if we can get rid of the mosquitoes, we can get rid of Zika. So it's very important for people to take a personal approach to making sure that there are not mosquitoes in their area, and that if they are traveling, they're protected from mosquito bites, as Jennifer said.
Ladies, thank you so much. We want to thank our Chief Medical Officer, Mrs. Cheryl Peekball, and our nurse epidemiologist, Ms. Jennifer Wilson, for educating us on the seriousness of this disease, the Zika virus. It is hoped that we will take the recommendations given by the experts to minimize the effects of this dreaded disease. On behalf of the Health and Family team, I'm Shay Dawn Burgess. Thank you for joining us.